Hi there, how are you? My name is Nick, and the topic of discussion for tonight that I did my counseling simulation project on is Child Glasser's reality therapy. One of the main focus points of reality therapy is making sure that outcomes are pretty much driven or derived from by the student itself or themselves. Something that we look for in reality therapy, especially when working with students, is helping them devise a plan, um, moving forward kind of from where they're at. And it's pretty much just teaching them about focusing on personal responsibility of their choices and their actions and kind of coming up with, a new plan and kind of like what the outcomes are of each of those. As we all know, for this assignment, we had to choose 3 techniques to use. As you will see in the video, I did utilize, for my first technique, is a self-assessment sheet or tool. It's pretty much trying to gauge where the student is at. So if at any time, you have a student coming in and it's about kind of like feeling, kind of where they're at in terms of like personality, like what are they thinking about, you can just hand it to them. Something that we did learn in class, I guess, about this as well is the feeling of love and belonging, power, fun, freedom, and survival. So each of those 5 elements are on the self-assessment sheet, and how I ranged it is low and high. There are no numbers involved, there's nothing there. It's kind of like just kind of where are you today? Tell me where you're at. How are you feeling overall? If you want to do it in like per week, or like how are you feeling this week? If you're doing like a once a week type of deal, or if it's like an everyday issue that a student is coming to you, that's fine as well. We know from the video that she did score, or you will know from the video that she did score low for each of those categories, and that's something that she needs to understand. And it's kind of like, why is she scoring low? Does she feel like she's failing in any of those categories? Her answer was yes. So our job is to kind of change that and put her more on a success-driven path, and how she can help herself solve her issues. That's kind of like where the main goal is, or what you want to do. For the second technique, something that I did utilize, and I didn't go in depth in the video kind of which is okay, but it's just something that you should take note on, is her ability to take account for her own actions and how she can control them. So or in the video, let's just say, as I was kind of asking her about how is she feeling about her family, she scored low on this for love and belonging. Was she not feeling loved and belonged? What is going on in her daily life? So something else that we gauge was her eating habits. So that's the survival piece of it. She mentions that she's going back to classes, and she's not really eating or taking care of herself. And that was a big concern that I think we all have. Especially when students come up to us, we do tend to kind of be concerned for them. I would assume so, considering you are going into higher education and it is all about students. It's not about us anymore. But the main goal there was kind of like, how is she changing it? So that is something that I kind of had her say, like, are you familiar with this? Like, this is something that you are doing, but this is how you're changing it. It was never about me helping her change it, or it is about me helping her change it, I guess, but it's more about her taking responsibility for it and saying that, this is now my choice. I am choosing to eat a granola bar instead of I can't eat a granola bar and I'm going to just be starving all day. And, that's not good for them either. In terms of the third technique that was utilized in the video, it's pretty much about how we should reflect ourselves, our image when we are dealing with students. And it's to be in an open, engaged environment that you feel that the student can be honest with you, that there's a certain level of sincerity involved, that you are being or that you're trustworthy. I know that some situations, depending on where you are, because if you're in counseling, like how I presented it in the video, not in just everyday life, them coming to your office, you do have to stress that anything that they tell you can be confidential up until the point where it can either hurt themselves or hurt others, and that's something that the student needs to understand anytime that they come to you. So something that we do learn. but that's why I ask her in the video, which I would never do, but like I would ask her kind of just to gauge it and to make sure that we are on point with the entire piece of it, was just to ask Tracy kind of, do you appreciate coming to me? Do you appreciate talking to me? How are you about that? And she pretty much responded, yes, I love coming to you. I was honest, I was open with pretty much everything that we had to talk about, and that feeling of her wanting to come back to me is what it's all about. So I'm glad that was portrayed that way, and it was designed pretty much so. Aside from that, during the session, I wanted to help her kind of see where she was being a failure, and how we changed it, again, to put her on that successful path and making her realize that she can actually control her own outcomes in life, regardless of what they are. And it's not, just because it's, she's having a bad day, she's dealing with loved ones, she's eating unhealthy, or not eating at all. And it's just something that she has a control over. So something to remember before you walk away, especially with reality therapy, is understanding that our primary goal is to have the client choose their own path. And that's going to lead to a successful outcome in the end for the patient or client or student or whoever you're dealing with. And it's something very important to stress. So thank you so much for listening. I hope you enjoy the video.